So moving kind of up the face, blepharoplasty are often called eyelid lift. So as we age, we see that there's some medial fat that can be in the upper lid. More importantly, we get this lateral hooding and it can progress to be kind of the whole eye. Some patients even get impairment of their vision because this can actually hood over the eye itself. Additionally, above that, patients will get brow ptosis, where the brow itself tends to drop. And then as we move to the lower lid, we see this double convexity that I was talking about before. This is your malar mound. This is the bone kind of peeking through. But this fat tends to what we call pseudo-herniate. And so the fat tends to kind of pooch out over this ligament right here. And then finally, everybody knows about the tear trough here, which we can oftentimes fill with filler, but can be treated surgically as well. So the upper lids we can easily do in clinic. If you don't have a lot of medial fat here and you really just need a little bit of skin off here and a nice closure to get a good upper blepharoplasty, we can do that in clinic, not requiring any anesthesia. If we're going to address the lower lid, we'll typically want to do that with anesthesia. As far as incisions, as I said, there is an incision for the upper lid. This is actually the thinnest skin in the body, and so it heals universally well. I have never had a patient with a concern for a scar after an upper blepharoplasty. Now, for the lower lids, we oftentimes can get by without even making any external incisions. We make an incision on the inside here where we don't need to make any external incisions, no scarring, no healing to be done on the outside. Occasionally, if there's excess skin, we will take a little, we call it a skin pinch. We'll take a little bit of skin out there and close it. But again, I've never seen a problem with the healing for that. So what can this correct? Lower blepharoplasty can correct these bags under the eyes, the discoloration here due to shadowing, the tired look that oftentimes can accompany these bags, as well as the tear trough deformity here. If there's excess lower lid skin, we can address that as well, typically with a skin pinch. For the upper lids, as I said, this can be done in clinic. Those baggy or those puffy upper lids, they look more full as we age. That can be addressed with an upper blepharoplasty. There's not a lot of pain that's associated with these procedures. Patients do note that there's 5 to 7 days of just feeling like a scratchy eye, irritated feeling. Not a lot of pain. And 94% of patients say this is worth it. So the vast, vast majority of patients are saying this is a very worth it procedure to have done. And then brow lift. I specifically I'm going to talk about endoscopic brow lift because it's by far the most common brow lift that we do for cosmetic reasons these days. There are other options such as direct, indirect brow lift, coronal brow lift. There's a lot of options to approach this, but endoscopic brow lift has really, over the past 15 years or so, been the workhorse for brow lifting. You can see if you look at this patient, he also could benefit from a blepharoplasty. He does have excess skin here, but his brow is fallen. He's got an asymmetric brow, left lower than the right. Oops. Left lower than the right, but both have fallen. Additionally, he's got these 11 lines here, these deep kind of creases, and he does have some wrinkling of the forehead as well. So that's exactly what a brow lift can correct. If you've got a drooping brow, any asymmetry, if we've got forehead wrinkles or these 11 lines, oftentimes we can reduce or eliminate the need for Botox, especially for these 11 lines. And that's because just by virtue of us freeing everything up here underneath, we can actually work to get these muscles not as active, and that can help with these 11 lines. As far as incisions, as I said, for the endoscopic brow lift, these incisions are all in the hairline. There are no incisions on the face. We make usually one in the middle, maybe some on the sides here, and then definitely on the sides here. What we do is we free all this up. These are the ligaments that are really pulling at the brow to pull it down. We free this up and we resuspend them in a higher location. We really can tailor the shape of the brow depending on if we pull more out here laterally or more centrally. So we can tailor the shape of the brow. That's something that you'd want to talk to your surgeon about. For the recovery, we can get into some occasional bruising above the eye here just because of this ligament release here. But typically patients will get about 5 days swelling, and it does kind of start up high and descend down to around the eyes, and then it dissipates. About 90% of patients say that this is worth it as an isolated procedure.